All right, my name's Ben Wood. I'm the program coordinator at the Gratitude Program. Also, I'm the family program coordinator for all our residential programs. I've organized that, and I'm going to spend some time with you today talking about boundaries. I think it's a topic that often when we work with families, I usually hear a lot of kind of sighs, and people struggle with boundaries, especially when they're dealing with addiction, when the family's dealing with addiction, and how to implement boundaries. Most people who come to this level of care probably have had multiple attempts at setting and keeping boundaries within the family. So we're going to explore that a little bit today, and what that looks like. What does a healthy boundary look like? What are our expectations? And how do those expectations tend to form what we think we need? And what we're getting from other people, and how we allow other people to treat us. And I do think that families really struggle with this, and it's the old proverbial line in the sand that just keeps getting moved and then moved and then moved. So we're going to look at some of those things, with the difference between a negotiable and a non-negotiable boundary. What does that mean? Does the patient have a boundary plan? Right? It's something that I would encourage as family therapists, that they don't leave treatment without a boundary plan, at least for the first 90 days, that there's a really specific plan on what is the boundary, where are those at, around relationships, around communication, around money, certainly around addiction, around those pieces and recovery. But how is the family going to integrate again? How are we going to communicate? How and when are we going to spend time together? What will that look like? All very important questions that should be asked and answered, really, before a person leaves residential treatment. So let's kind of start. I want to start with this kind of a picture in your mind. The best metaphor I can think of is really a road, highway, with those yellow lines painted on. I want you just to picture that in your mind, see those lines, that center line, and usually when we see that dotted line, it would indicate a boundary, right? It would indicate that I can pass with caution, right? If someone else is coming, it's not okay for me to cross into their lane, but if it's clear, I can pass. That's a good description of a negotiable boundary, right? As long as I'm not impacting in a negative way the person in the other lane, oncoming traffic, right, I can pass. I have permission to do that. Then we have that solid line there in the middle of the road, which indicates to me that it's not okay for me to pass. That if I passed into the other lane, I would be infringing on somebody else's space, on their safety. Certainly, if they're passing in my lane, they're infringing upon my psychological wellness, right? Lots of things come up when they cross into my lane. So that's a description too of a little firmer. I would say maybe like a first level non-negotiable, right? It may not end a relationship, but it may change a relationship. The relationship may have to look different if that is crossed. The other piece of this is I want you to picture that same road. I want you to see that guardrail just beside the road. So that is what we would define as a very hard, non-negotiable boundary. To cross that would mean certain injury and death, right? So emotionally, we're talking about the death of a relationship, the drastic change of a relationship, the ending of a relationship. That would what I would be called as a really firm, non-negotiable boundary. So I want to define it that way so that you can keep that in mind as we go through, that we have some sort of picture in our mind of what are these different pieces. What I find with families often is that we want to apply non-negotiable boundaries to negotiable circumstances. We want to weaponize boundaries and use them to manipulate a response out of the people that we say we love. Quite frankly, that's not a boundary. That's called manipulation. That's something different. That might need conversation, right? That might need adjustment, but that's not a boundary. Other part of that I want to start out with is this statement that a boundary is not a boundary unless it's communicated. Right? Communication happens when I share a message and that message is heard and really presented back to me, so that I have the assurance that it was heard. So if we're talking, doesn't necessarily mean that we're communicating. If we're not talking, there's no such thing as not communicating. Sometimes we communicate with our silence. You know? The point around boundaries is it's not really a boundary. It's not a healthy boundary if it's not communicated. If we're not talking about what that boundary is, what that expectation is. I think often when I do couples work, what I hear from couples often, they wouldn't use these terms, but they come in and they say, we have trouble with communication. And then they spend 10 minutes communicating back and forth in the way they do when they sit at home on their couch. Right? The reality there is that the issue, the rub is not in communication, the rub is in expectation. The rub is in boundaries. The rub is in we're not communicating what our expectations are of each other, and instead of communicating, we take a stance of resentment. So what a wild thing here, this wild dynamic, where I'm not really telling you what I need, but I'm holding you responsible to fulfill it. And then when you don't, I get angry. And then you see me get angry, and you get defensive, and then here we go. Round and round we go. So we're going to look at that today, just looking and diving into what makes a boundary, why do I need a boundary, how do I make a boundary, how do I keep a boundary, all those important questions. So boundaries really, quite simply, are it's a system of limit setting. I'm setting limits. And we're talking about limits in this regard, that I need boundaries both to protect me and to contain me. I think people get a little confused on this, right? So I need boundaries, protective boundaries, may be around my physical space. They may be around the way I let you talk to me, my emotional health, my psychological health, physical health. It's the way I'm protecting myself from other people. Now, I tell patients, I tell families quite often that we, as adults particularly, teach people how to treat us. And how do we do that? We do that by either having really good boundaries and good communication about what our expectations are, or we do that by not having boundaries or very poor or loose boundaries, thus inviting them to treat us however they choose to treat us. So as an adult, I'm not a victim, I'm a volunteer. In adult relationships, as an adult, I can no longer be abandoned. I can't. I can feel abandoned. But the reality is I'm responsible for my own needs. Crazy thing happens in addiction is that addiction twists relationships in that both family and addict really try hard to manipulate each other to meet each other's needs. And it ends up in a very dysfunctional pattern. We use words like codependent, we use words like enmeshment, right? And people respond differently to that. Sometimes people disconnect and they distance themselves. They may do that through drugs and alcohol or process addiction. They may do that the other way and turn inward and do that through depression, anxiety, self-loathing, self-deprecating, right? We manage that in a lot of different ways. The bottom line of that is, if I want healthy relationships, I've got to have healthy boundaries. When I begin to meet my own personal needs in a healthy way, crazy thing happens. Other healthy people meet some of my needs. Not all, some of my needs. When I require other people to meet all my needs, because I have a lack of boundaries, what happens is that healthy people feel manipulated. So healthy people run away from me. I see this dynamic happen over and over again in the families that we work with here at Pine Grove. There's a lot of anger, a lot of disappointment. And I'm not just talking about the family, I'm talking about the patient. There's hurt, there's trauma, there's disillusionment. In the center of this thing is addiction. And certainly we need to talk about addiction, we need to work with addiction. But the reality is that these relationships outside of that are all pointing toward that thing, are in complete wreckage and have to be in some way rebuilt. The beginning point of that is, how do I allow people to talk to me? How do I communicate how I feel? As simple as using a feedback loop, right, to communicate how I feel. Not because I'm a little kid and I don't know how to talk about how I feel. No, because I need protection and I need containment. I need to be able to talk about what's going on without exploding. So let's talk about that a little bit, containment. So containment is what I do for myself to protect other people from me. This is a boundary that often people overlook. They expect that boundaries really just kind of work one way. My boundaries for you, and often miss the point that, real true boundary isn't really about the other person. It's about me. And I need both that protective boundary where I'm communicating to others. This is what I'll allow you to do. This is how I'm going to protect you from me. And my communication and my expectation. So containment boundaries, again, limit what we'll do or what we won't do for others, what we'll allow others to do or not do for us. Abraham Lincoln says, my right to swing my fist ends at the other man's nose. I think it's appropriate to think about when we think about boundaries, that certainly I have a right to what I feel, a right to what I think, a right to where I go or where I occupy space. But again, when I cross that middle line into someone else's lane, right, I'm crossing over into what's theirs. I have to be mindful of that there often is going to be a reaction to that. That I'm either going to have to negotiate, or I'm going to have to humble myself and ask for forgiveness and make that right. Right? There's going to have to be some action there if I'm impacting other people. Why do we think boundaries are important? Is our next question. Why are they important? What do they protect us from? I usually tell people anything that's a noun probably needs a boundary. Anything you could think of that's a noun needs a boundary. Again, my space, my feelings, my body, my house, my car, my property, my children, all those things. Anything, again, that's a noun probably deserves a boundary. So when we think about what needs a boundary, why we need a boundary, we think about a couple categories. We think about emotional boundaries that I need to feel okay, to feel safe. We think about physical boundaries. Here in the South, not so much right now, but typically people like to hug. They like to invade space. Southerners are notorious for kind of close talking and being really close. When I've had friends or even patients that have come from other parts of the country, that's really difficult for them to get used to. And many times a different part of the country would even consider it rude to do that. So depending on your context, the family you grew up in, right, there's often differing boundaries around your physical body. So emotionally, physically, intellectually, our thoughts, right? Sometimes we need containment boundaries around that. I'm okay that I have an opinion. As a healthy, functioning adult, because I have an opinion doesn't mean I have to share that opinion every time, every place, right? That might need to be a boundary around how I share that part of me. The boundary, again, a protective boundary, what I'm allowing other people to share with me. So we do a lot of feedback here in treatment. And people, particularly that struggle with addiction, struggle with feedback. They get that and they automatically internalize that as the truth. And I didn't see that about myself. And they either go into shame, which produces a lot of anger. They push back and say, how dare you talk to me that way? Or they just take it in. and go, wow, that must be who I am. So a good protective boundary around this intellectual piece or this feedback is the ability to kind of catch that outside of us. Really. I often tell people to do some kind of mindfulness and visualization and like see that feedback coming and catch it. Give yourself an opportunity to slow down and look at that. Maybe it is something I haven't seen. Instead of just automatically internalizing that feedback, set an appropriate boundary around what people are saying to you. Around relationships. Often in addiction, the people who are trying to help me, I push away, and the people who are hurting me, I pull near. So boundaries around relationships often get confused, right? In addiction, people push away others that can tell them no. Or at least not now. They do a really good job of only surrounding themselves with people who say yes. You should drink more. Yeah, let's go party. And those relationships that there's accountability in get pushed away. So part of recovery, again, is appropriate boundaries around relationships, around where I might go, who I might be with. All very important pieces. And not just for the patient. I want to make sure that we speak to both. I worked with a lot of families who struggle to know what to say to friends, to family members, when their loved one is here. And they feel a lot of pressure to know what to say. And we talk about kind of those relationship boundaries that need to be in place. So even giving them permission, as a patient, you should give your family permission to not tell your story. And I say it like that because it needs to be, you need to take it in that way. So to say to our loved ones, you don't have to tell them anything. If you don't feel comfortable saying anything, it's okay for you to say nothing. It may be okay to say, thank you for your support. It may be okay to say, that's not something we're going to talk about outside of our family. A lot of different ways to set a boundary around relationships. I usually tell families, if you set a good boundary, I would encourage to start with some gratefulness, right? Just to say, I'm so grateful that you even asked. That's not something we feel comfortable talking about with people outside of our family. I hope you understand. If you set that nice, firm, concise boundary and people push through it, the people who push through it are pushing through it not because they care about you. So the ones that weed out, boundaries around relationships for the family, good way to weed out who is really intent on supporting you and who just wants to gossip and get information about you or your loved one, set a good boundary. The ones that listen really want to support you. So there needs to be boundaries for both patient and family. So again, external, internal boundaries we've talked a little bit around. So those are why boundaries are important. I guess our next question would be, where does that sense of boundaries come from? Where do we learn that? In one of our lectures that we have online, you'll hear about family dynamics and rules and roles that we play in our family, the family that we grew up in. Another term for that would be just our family of origin, right? So what rules we had, they could be spoken or unspoken rules. What roles we played in the family that we grew up in. How we talked about strong emotion. How we dealt with conflict. How we dealt with loss. Or how we celebrated. All of those consist and make up translate to, how do I keep boundaries as an adult? So we pulled each one of those apart. We won't do it for the sake of time today, but pulling each one of those apart. If I grew up in a family that only saw me or valued me when I did well and performed well, right? If that was the family that I grew up in and I derive value from what other people validate me for, that will impact my ability to set containment boundaries and protective boundaries. Why? Because I'm dependent. If I'm going to feel okay, you got to be okay with me. And if you're not okay with me, I'm going to let you push into my boundaries. Because I'm afraid that if you're not okay with me, I won't be okay. That's just one example. That's just around communication, the role that you may have played in the family that you grew up in. In the later lecture, I'd like you to consider and put some of these pieces together, that how I grew up, the family I grew up in, it helped me determine and did translate into adult relationships and how I communicate and how I connect. You were not, none of us came out of that unscathed, right? I have not met a family that's completely functional. I'm not even convinced they exist. Maybe I'm a little biased because the only ones I meet in my office are not functional. But I'm convinced that all of us, I look at my own life, I look at my own family, and I think, even with my children now, like I look back on things and I say, why would you do that, Ben? How did you do that? Why did you do that? I didn't do it out of malice, and most parents don't. But those things impact how we set and keep boundaries now. It really kind of forms from three things, and I'm going to give them to you here really quickly. Virginia Satir, one of my favorite family therapists, pioneered some family therapy in the early 60s. She talked about a survival triad of where we learn to kind of cope with life, and we learn it really young. We learn it between the ages of really birth and about 5-6 years old. We learn this process. And it's really the identifying of who I am. So me, others, and context is what she would say. So I'll put that in a little different terms. What my identity is, who's going to nurture me, and is my environment safe? So I want you to think about that as we go through boundaries. Is when I begin to set a boundary, some of those containment boundaries need to be around how I see myself. How I communicate to others, both containment and protective. The others part, and we learned this from our parents, right? So if we have nurturing parents who take care of our needs for the most part, we learn that other people can meet our needs. So when we talk about trauma and how that may affect, or a disruption in that attachment that happens again, very young, birth to 5 or 6, right in there. If that's interrupted, what I begin to internalize is that my identity, sometimes I can trust that other people will meet my needs, but sometimes they don't. So for a child, what they do with that is they begin to internalize that the real determining factor there is me and not the caregiver. They don't have the reasoning power to be able to say, well, that was mom and dad. They did that. They did the best they could. We do all that stuff later in life. As a child, we just internalize that there must be something wrong with me. So that's the other, the nurturer, right? Was I nurtured? Was I not nurtured? Usually if I come from an environment that's not nurturing, either not nurturing at all or hit and miss, I get these mixed messages, I begin to have a real distorted view of safety, of my environment, of my context. What's safe, what's not. That interrupts our ability to set good boundaries. From families at this point, they begin to say, well, what did we do that was so wrong that created this? And I want to kind of relieve that a little bit by saying this addiction isn't about what you did wrong or right. There is some component to treatment and to recovery where all the pieces of the family take ownership of the whole. This isn't going to be about, if we can just get Junior fixed, then the family will be fixed. They are, in essence, co-occurring, right? So This is how the patient has responded to the dysfunction in the family, right? They've taken on all the symptoms of the whole family. If Junior goes off and gets better and then comes back to the family, they're either going to suck Junior back into that old dysfunctional pattern, and here we go again, the family will stay the same, or Junior will set good boundaries and have some separation, and then the family will either change and adapt, or someone will take Junior's place. Someone else in the family will fill that role. Happens over and over again. The person in the family with the most symptoms, especially in a dysfunctional family, has the most power. The person who's the most problematic, that draws the most attention, has the most power. That's why families begin to believe if we could just fix Junior, all this would go away. The reality is if Junior is really going to be connected to the family, that everybody has to recover. So in order to do that, everybody has to kind of own this is where we are. This is the reality of where we are. We can't have anything different unless we're willing to take responsibility for what's ours, which is actually kind of a freeing thought. It's a freeing idea that if I can just be responsible for what I've done and the impact that I've made, good or bad, if I did this, I can choose to do something else. If I continue to deny that that's what I did and that was the impact I had, I have no other option to do anything else except be in denial. So let's keep moving. Flexible and inflexible boundaries. So again, in realms of how we see our family, because that's where we learned how to set good boundaries, is in the family we grew up in. So how do families deal with dysfunction? How do families deal with trouble when trouble arises in one of the members of the family? We see several different responses. Sometimes we have a very rigid family that has a very rigid set of rules and roles. I want you to kind of see that as a kind of a paradigm. So on this end, on this far end, is that really rigid family. And when, just for the sake of continuity, we'll use Junior again. When Junior acts out and he stays out too late and has a little too much to drink and comes in drunk, what does the rigid family do to manage his behavior? Real simple. They make more rules. They may enforce more rules. They may actually even create some new rules. They may be more stringent or more rigid on the rules that they have. In that rigid family, some benefits is the roles are very clear of who's parent and who is child. That's not a bad thing. But the roles are inflexible. The rules are inflexible. So when trouble comes, there's no nurturing. There's no real connection. There's no talk about how we feel, what we think. Again, a child that grows up in that, and it's strictly that rigid environment, often grows up thinking that they're the problem. That if they would just quit messing up, the family would be okay. Dad would stop yelling at me, Mom and Dad would stop fighting, if I could just get stuff together. So that's that rigid family. The rules and the messages in the rigid family are don't talk. Not really. You can talk about the weather. You can talk about who took out the trash, but you can't really talk. You can't dream in the rigid family. Don't feel. And if you do, don't talk about it, because we don't talk. Don't ask for help. Because if you ask for help, then you're weak. And we don't prize weakness. So 83% of addicts grow up in either that rigid family, or they grow up in this one on this end, which is the collapse boundary or the enmeshment. Everybody's roles and rules. This is the family that's really loose. A lot of individuality, right? But we're going to say everybody's in everybody's business. Roles are often confused, right? Parents become children, children become parents, children become spouses in some ways, emotionally. In that family system, again, there's some powerful messages around emotion, around how we communicate, around leaving the family. You can't leave. So in this family too, it's really hard to dream. It's really hard to see yourself outside of it. Often the result on these two ends, on these two extremes, is a person who either falls in line and does what they want and has this internal conflict always in them that they need to numb from or escape from, or they get really good at lying. They keep a secret life. They compartmentalize. You know, Junior went out last time. Next time, Dad's not going to catch me. It'll be okay just as long as no one knows. It's problematic. Why is it problematic? Because then they start to form a distorted thought that if people really knew who I was, surely they wouldn't love me. They wouldn't even want to be around me. So here it is, these two opposing, and this is how this family deals with it, that rigid family. The enmeshed family deals with it by let's draw another line, let's draw another line, let's draw another line. I hear things from the enmeshed family like, I would never give up on my children. That sounds really kind of altruistic and good, but the reality in that enmeshed family is I want Junior to get better because Junior makes me feel bad. Makes me feel like a bad parent, like I didn't know enough and I didn't do enough. So he needs to get better so that I can feel better. That's kind of a classic definition of over-enmeshment, right? That parent needing them to be okay. So right here in the middle, where often health is, not to this extreme or that extreme, we have good boundaries. Roles are appropriate, so people fit into the roles that they should be in. Kind of the hierarchy of the family is level, right? So parents are here, children are here. Things like, even like birth order is in proper order as far as the dynamic of the family. The family communicates, trusts. They may not always agree, but it's safe to talk. It's safe to engage. For me, I'm thinking about that, man, I'd love to grow up in a family like that. That would have been fantastic. Those do exist. Most people don't start there. They start here and they end up here. Out of really intentional, a lot of intentionality about how do we create this for us. Sometimes it's in response from escaping these two extremes that we come together and say, I don't want my family to be that. There's a disruption in the pattern. I will put a little caveat, a little warning, that I think inevitably the modeling that we experience is going to show up somewhere and probably will need attention. Right? I don't want anybody to be distressed by that, but I can say for myself, there's been plenty of times in my adulthood that I've said, I will never do that to my child. I'll never say that. Ever, ever. Only to find myself doing that and having to catch myself and correct, kind of back off of that and humble myself so that I can do it in a different way. All that is about healthy boundaries. At this point, lots and lots of questions about the family we grew up in, the family that we have right now. The questions I often get just center around the conflict that addiction has brought, the dynamic that it's brought into the family, because it's like having another family member here sitting in the room with us. And the anger and the pain, again, not just from the family, but from the patient, the resentment that often builds. All those things need attention. And if we're going to contain ourselves and protect ourselves, we've got to attune to those things. We can't pretend. One of our other family therapists says, yeah, you could sweep it under the rug, but then all you have is a lumpy rug. Right? Those things don't go away. They need to be processed. They need to be talked about in the family. So the impacts of addiction need to be talked about. For the patient, the reality of taking ownership of their impact, building empathy, not sympathy, but empathy for the people in their family. At this level of care, what I find unfortunate is most people I work with, they come in the door and they've completely underestimated the real impact on the people they love. They just have underestimated it. For most people, it's just too painful. There's too much shame, there's too much pain. And they're dealing with their own pain and shame. It may even be an unfair expectation that as they walk in the door for them that we would expect that. We don't expect that. But as people recover and get days under their belt and their head starts to clear and they start to see the wreckage, people respond in a couple different ways. Sometimes they push into that. They start to own it. They start to feel it. Those people make really quick progress. Others pull away from it and they start talking about everything from the food in the cafeteria to their lumpy mattress, to what's happening on the outside and what I have control of, and I'm going to lose my job. And all the focus is outside, all the blame is outside, and until that shifts and we have some responsibility and accountability, there can't really be recovery. The other side of that is accountability and recovery or responsibility don't by themselves produce sobriety. I can abstain from something and not deal with those internal things, conflict in the family, trauma, all that stuff that we've listed, and just be a dry drunk. Have all the same patterns, talk the same way, interact the same way, want to keep the same friends. I'm not really addressing any of those other things. So we need accountability, we need responsibility, but we need meaning making. We got to figure out what happened. How did we get here? How did the family get here? Where are the boundaries that have been skewed and have been pushed through and breached? Where are those? How do we correct those? Just like the other side, just finding meaning in itself won't keep people sober. What that does is it creates a whole lot of victims. Families don't like that because they feel victimized, and patients don't like that because they feel like the family's victimizing them. So meaning making on its own can't produce sobriety. Accountability and responsibility on its own can't really produce sobriety. We need both. We got to figure out how we got here. See what that is. See what it is. The part of that's taking responsibility and accountability. We've got to deal with the internal stuff. Otherwise, we just have a lumpy rug. Inevitably, we're going to trip over it. So let's get into just briefly some ability to set good boundaries. How do we set a good boundary? Again, a component there is it's not a boundary unless I speak it. I need to be able to speak it, communicate it. And in terms of communication, it's not really communicated unless the other person hears it. So I usually tell families that silence is not permission. It's just not an answer. So if I set a boundary and that person doesn't respond, that's not agreement. That's not a successful negotiation of a boundary. It may be stonewalling. It may be emotionally triggering for the other person. There may be a lot of components there. So good boundary setting is always communicated and it's always reciprocated. There's a communication that happens with it. So those containment protection boundaries should always have a consequence. This is where people get really stuck, is the consequence. This is where families get stuck. This is where couples get stuck. I'm going to make some hard statements here. The consequence for the breach should be equivalent to the breach. And we have to realize that when we, as a family, as a spouse, respond in our trauma, in our anger, in a moment that's not about our trauma and anger, what we risk is setting a boundary or a consequence that doesn't bring us back together but pushes us further apart. Same for the patient, right? If I'm responding out of how the family's treated me or what I suppose the family thinks about me, right? And I sit in that and I'm responding out of that, my consequence may be really severe and it may not match what really happened. So let's give an example. So you said you were going to go to the store and you didn't. I've heard this example. You said you were going to go to Walmart and you went to Winn-Dixie. Okay, a spouse of a sex addict. You went to Winn-Dixie. You always lie. This is what you do. You always lie. So, because you can't tell me the truth, you got to sleep in the other room. Okay? So, pulling that apart, really, that anger that spouse is experiencing, I think is justified to what she's experienced, but not to the circumstance. So I have to tell the patients, or I'm telling patients, you got to learn to endure that and see that for what it is and communicate through that. You got to handle that. You can't react. You can't be defensive. You got to just manage that. Most of that's about time, allowing that person to calm themselves down, having a good timeout plan, right? So I say all that to say that the breach of the boundary should match, right? The consequence there should match. So there are going to be some non-negotiables, right? We talked about that rail in the beginning. If you cross this, it will mean sure end of the relationship or severe change to the nature of the relationship. Absolutely, those are there. Maybe that centers around relapse. It may. I mean, if you've been to 10 treatment centers in the last 10 years and your family says one more and we're done, that might be the non-negotiable. That boundary is contact with another person, sexual contact, any contact with another person that fits your arousal, we're done. That might be that non-negotiable boundary. That there is no negotiation, there is no communication around that. That's it. If you cross that, that's it. Most of the stuff that you're going to deal with in the first 90 days does not fit that. Doesn't. You're going to find conflict around how you communicate. You're going to find conflict on functional matters that's around the house. You're going to find conflict when you are triggered by something that's really unrelated to what your experience was, but for whatever reason, you opened the mail that day and you saw that credit card application and what you thought was all those secret credit cards he had. Right? You had no control over that. There's going to be a moment of conflict that will have to be negotiated. That's where the majority of the work will be in the first 90 days around boundaries. So I'm going to give you just a couple things here, really quick. And this is what I would encourage, that when you're setting a boundary, I'm just going to give it to you just in this form, and a boundary should be concrete, it should be repeatable, it shouldn't have a lot of words, it should be very concise. I would always encourage you to start with what you feel and use I statements. So I felt angry, different than you make me feel angry. I felt disappointed versus you always disappoint me. Beginning with what you feel creates a little bit of emotional space so the other person doesn't have to begin from a place of defense. So start with what you feel, and then you may move into what you think. So the thinking part may be, we use here at Pine Grove, we use what I make up. That could be a lot of different things. That could be what I was thinking. The story I told myself was this. Right? So that's the first half of it. I'm communicating where my expectation is. Second half of it may sound like this. If you continue to lie to me and not be where you're supposed to be, I'm going to take a moment. I'm going to share what I think and what I feel. If you continue in that behavior, here's the important words: I will take care of myself by, and then we fill in the consequence. Very important. So I start with what I feel and list my expectation and what I'm thinking about the circumstance. I move into this very concrete statement: when you did behavior, right? When you do that in the future, I will share my thoughts and feelings, right? If you still choose to do that, I'll take care of myself by doing this. So again, boundaries are not ultimatums. They're not, you've got to do this, you've got to do this. It's, if you choose to do that, here's how I'm going to take care of myself. This is what I'm going to do, what I'm going to need to do to take care of myself. So just some components there. It should be sharing of emotions, right? Should be sharing of the context of what I think is going on, and then communicating the boundary. If you do this in the future, I'll take care of myself by doing X. Being careful to use I statements. Again, less words, the better. If you are in a heated argument, you come to a point where you move out of that prefrontal cortex back into the midbrain again. Both of you are there. You're not going to solve it in that moment. Believe it or not. Spending another 35 minutes, hour, 2 hours talking about that thing. Every minute that passes is a minute that you lost, because you're not going to solve it. That part of your brain's not even on. What we're going to suggest is that you start, you're going to work on this in a 90-day boundary plan, so you start with a firm set of boundaries and expectations before you leave treatment. Then that's on the table. That's understood. The negotiable, the non-negotiable are all understood. Boundaries around relapse. What do those look like? Boundaries around how relapse is communicated. What does that look like? Where do I want to learn that information? Do I need to hear that at the kitchen table, or do I need to hear that in the therapist's office? Where does that happen? Your family therapist, your primary therapist will help you as a family, as a patient, to negotiate that and work through that. Each program does that a little bit different. But there should be a plan. You should be asking, what's my boundary plan? As a family member, you should be asking that question. What are our boundary plans once we leave? There's a couple myths that kind of get in the way when we begin to set boundaries. When people haven't set good boundaries initially, they're usually really aggressive in how they set them, which I often, as a therapist, find a little bit amusing. Because it's like we've not had any boundaries, and then it's, we have all these boundaries, and we really push hard. What I would say to that is I think all of us need a little bit of anger in order to set a good boundary and keep a good boundary. Like that, we need that piece. I'm not saying rage, but we need a little anger active in us. But here's a couple of myths that I see in families. If I set a boundary, I'm being selfish. That could come in a lot of different ways. If I tell them what I need, if I tell her what I need, I might disrupt their recovery and they'll relapse. So if I set a boundary, I'm not being selfish. If I set a boundary, I'll be hurt by other people. They'll leave. They'll yell at me. They won't take care of me. Also a myth. If I do set boundaries, I'll end up hurting other people. I don't want to hurt their feelings. I don't want to be, the one that's known for being mean. And the last one here, I think, is really important. You may think it's contradictory to our conversation, but boundaries are not permanent. Boundaries are contextual. They're based on relationships. They're based on the moment, right? I know that brings a lot of confusion to some minds right now. When you leave treatment, that's a season that you will have this set of boundaries. And over time, those should be revisited and talked about. Never changed without collaboration from professionals. Don't change the boundary plan without input. But they should adjust over time. we're going to encourage that you start really stringent, and as you grow and move and recover, that those adjust. Some of them will change, some of them won't. Some of them will be different in 30 days versus 60 days, depending on where everybody is in their recovery. So takeaways really from today, really the most important thing, talk to your family therapist about a boundary plan. Start practicing that feedback loop. When I saw that, I felt, right? Start using that. Even if you're practicing in the mirror when you're driving down the road or when you're getting ready to work in the morning, practice using that feedback loop. The more you use it, the more apt you're going to use it when there's conflict and stress. So boundary plan, practice, feedback loop. All right. Thank y'all very much. I appreciate your time, and good luck in your recovery.